Look, we have this staggering number of deaths here in the United States, more than 530,000 now from this pandemic, more than any other countries. Dr. Fauci says we're one of the worst. So there's going to be a historical reckoning about why the United States was so different from other countries, did so poorly. You were right there. What do you think?
You know, it's a combination of factors, and I'm still reflecting on that myself. I'm trying to figure out why a country that was so good in those 45 days to slow the spread, that really protected their loved ones, stayed inside, followed the messaging, then just, in May opened up without following the criteria. You can see states that followed the criteria. You can see states that maintained their mask mandate. You can see states that opened retail but still maintained their mask mandate have actually done quite well. And as you said, there will be a reckoning. And that's what I carried out to every governor when I went out to the states, is this will be studied for decades. And there will be a state-to-state comparator of how states did.
But isn't that about leadership? Isn't it just the president and the entire apparatus of the federal government communicating the urgency of the message and the steps that are needed to make sure we don't have 530,000 people dead from it?
That's exactly correct. And that's why I started this session by really talking about how I'm really been gratified and happy, to be honest, as a public health official and as someone who's worked globally, is having leadership consistently messaging, whether it's the CDC director or Dr. Fauci or President Biden or Vice President Harris. All of them and all of their spokespeople are communicating exactly the same pieces. And I think that is critically important. I think when you have different messages, people perceive them differently to fit themselves and their lifestyle, and use it to give themselves permission to perhaps do things that may put other people at risk.